I have verified my order and the need for the procedure. I've gathered all my supplies. Perianal cleansing has been done. Hand hygiene has been performed, and I'm donning clean gloves. I have introduced myself to the patient, verified the patient with 2 patient identifiers, explained the procedure, adjusted the bed to a comfortable working height, and provided privacy. I'm opening my catheterization kit, and I'm using the plastic bag that it came in to collect my trash throughout the procedure. I'm going to let the patient know that I'm going to expose them. And I'm just going to place this plastic bag somewhere that's going to be convenient to collect trash. I'm going to remove my clean gloves and perform hand hygiene and begin to organize my supplies. I'm going to open the sterile kit, only touching the 1-inch margins around the kit, and using caution not to contaminate any of the supplies inside the kit. I'm going to remove the gloves and put them aside because I'm going to use those sterile gloves a little later in the procedure or in my organization of supplies. I'm going to take the first drape and place it between the patient's legs. And I'm just touching the edges of the drape. I'm going to use the second drape and place it over the patient. I'm going to perform hand hygiene and don my sterile gloves. Apply my first sterile glove. Then I'm going to apply my second sterile glove, grabbing from the inside of the cuff. I only need 1 set of the antiseptic swabs for a female catheterization, so I put it aside. So I'm opening my swabs so that they're ready when I need them. I'm going to take the top off of my kit, and I am using caution to keep all my supplies for my kit on my sterile field within the 1-inch margins. So when you get into your kit, you're going to see that your actual Foley catheter has this plastic protective sleeve on it. You want to remove this protective sleeve while you have both of your hands sterile, so that later on when you have one contaminated hand, you're not trying to remove this sleeve with one sterile hand, because that can be very, very difficult to keep that catheter still sterile while trying to remove that plastic sleeve. And I'm using caution not to touch my catheter on anything. If my catheter at all becomes contaminated, I cannot use that catheter for the Foley catheterization. I will have to replace it with a new one. I'm going to attach my syringe with either my sterile water from my balloon, so that I'm not trying to attach it later when I have one contaminated hand, because again, that could be difficult and I might break sterility. I'm opening my lubricant and I'm squeezing it out near the tip of my catheter so that it's easy for me to lubricate my catheter later. I'm going to put my swabs inside my kit, and I'm going to carry my kit over to my patient, using caution not to contaminate my hands. So I'm just adjusting my swabs so they're easy to get out. With my non-dominant hand, I'm going to spread the labia. And I'm cleaning from anterior-posterior motion, so from top to bottom. And I'm using one swab at a time, and I'm cleaning from lateral to center. And my last swab is going to go over the meatus. I'm going to grab my catheter and lubricate it. After I put some lubricant on it, I'm going to start to advance it through the meatus until I see a urinary return. After I've seen a urinary return, I'm going to advance the catheter 2.5 to 5 centimeters. I'm going to inflate the balloon with the manufacturer's recommended amount of fluid. After I've inflated the balloon, I'm going to start to throw away some of my trash. I'm going to perform hand hygiene, apply clean gloves, and secure the catheter. After I've applied clean gloves, I'm going to use a catheter securement device to secure the catheter to the patient's leg. I'm going to get the urine. After I secure the catheter to the patient's leg, I'm going to get the urine collection device and attach it to the bed or the hooks on the bottom of the bed. I'm using caution as I get my bag to not put it over the level of the patient's bladder because I don't want any urine that drained from their bladder into the bag to drain back into the bladder. I'm going to clean up my work area, remove my clean gloves, perform hand hygiene, put the patient into a comfortable position, cover them up, raise the bed rails, lower the bed to the lowest position. Ensure that the patient has their call light. And then I will document my procedure according to my facility's protocols.